Hey YouTubers, Mike Martins here with the Mike Martins channel. Guys, I got a really important article I want to share with you guys. It's something that I've been bringing up quite a bit. Bringing it up once in a blue moon, discussing it on Mike in the Night, or live call-in show if you want to be part of it. Set your reminders on the channel. Um, our federal government has given hundreds of millions of dollars to help find a cure for COVID or some sort of vaccine for COVID, and unfortunately, I guess that's something that federal governments need to do at a higher level to show the rest of the world their contribution to COVID. But one thing that governments aren't doing on a big, grand scale level, I've noticed, especially in Canada and parts of California and stuff, is that they're not um, taking care of their own. And this is a big deal. And what am I talking about? BC paramedics respond to record-breaking number of overdoses in July. During the month of July 2020, paramedics were called out to 2,706 overdoses, approximately 87 overdoses per day across the province, according to new figures from the BC Emergency Health Services. The average per month has been generally about 2,000. So it's opioids, fentanyl, and this is a war. A lot of all the mainstream media would not label this as a war. We've been at war for affordability, and I'm not talking about affordability housing. Canada or whoever is in charge or whoever is running our corporation is basically selling out to the highest bidders, leaving the middle class to fend for themselves and compete with laundered money. Now, what's happened is how did they build such a mass amount of money is by basically spilling our streets with fentanyl and these opioids and all this crap. Now, looking at this picture, I get very emotional when I see this because you could tell by the person's hands that he's very young. And what really hurts me inside is when I see he's wearing two different shoes. And that really hits hard, when you see somebody young like that maybe needed a good talking to, maybe needed to be criticized, maybe somebody needed to give them a good sit down, and that's probably all they need, some people, Yes, go ahead. People will comment mental health issues, mental health. Guys, when I was growing up, you had maybe one or two persons in the city that I knew of on a specific corner that had some sort of mental health issue. And it was the same two people you would see on a regular basis. This is getting way out of hand. 2,000 overdoses per month. Now, doesn't even come close to how many people are contracting and dying from COVID. This is a big issue, and this is something that's not being addressed. BC paramedics have recorded their busiest month for overdoses since the health crisis began in 2016. During the month of July, paramedics were called out to 2,706 overdoses, about 87 overdoses per day, across the province, according to new figures from the BC Emergency Health Services. In the highest monthly number of overdoses recorded since November 2016, and since the public health emergency was declared 4 years ago, the average number of overdoses handled by BCEHS is about 2,000 a month. There have been devastating consequences for people who use substances during dual public health emergencies, said Judy, Minister of Mental Health and Addictions, in a statement on Tuesday. Last month saw a record number of lives lost to overdoses, all the more heartbreaking since before COVID we had managed to bring the deaths down for the first time. So overdoses up 700 in July. Overdoses call in July for 10 BC cities with the most calls. So there it is: Vancouver, Surrey, Victoria, Kelowna, Prince George, Abbotsford, Kamloops, Nanaimo, Langley, and Burnaby. So there they are right there, all the cities within 1 month. Darcy's comments came as the province announced the scaling up of overdose prevention services, expanded access to safe drug supply, and new outreach terms. A part of the expanded measure, 17 new supervised consumption sites and 12 new inhalation services are slated to open in communities hit the hardest by the overdose crisis. A total of 42 new full-time registered nurses, psychiatric nurses, social workers, and peer support workers are also being added to, and existing outreach teams. According to BCEHS, no community was safe from overdoses in July, with many in small communities across the province through Vancouver, Surrey, and Victoria still recorded the largest number of overdoses. The overdoses recorded in July is 65.4%, were men compared to 34.4%, which were women, with the largest number of overdoses recorded in the age group between 21 and 40. Paramedics are urging people not to use alone and call 911 if someone is experiencing an overdose. In calls where paramedic is able to respond, the individual has no more than 95% chance of survival. So guys, I kind of want to throw this out there because this is something I've brought up many times on the channel, and this is something that I've brought up because of it's a major concern, and our youth is being wiped out on the streets in huge numbers. A lot of the drugs are coming from factories that are it's being developed and made in China, and it's flooding the streets of Canada. During the last election debate,
Hello.
There was no discussion whatsoever about this whole thing whatsoever, about this whole overdose thing and this opioid and homeless crisis and fentanyl crisis. Anyways, guys, leave your comments below. Let me know what you guys think. I look forward to reading your comments on this. And this is something definitely that it could be almost... I'm going to read your comments. If you guys can read my mind, if you guys know me well enough, you'll know what I'm thinking about this. Let me know.